president and the Democratic Party.
Hey, Chris, let me get you to hang on for a second. I've just got some breaking news handed to me. Our colleague over at CNBC, John Harwood, is saying that he just left an interview with House Speaker Nancy Pelosi, and she is saying that she can get the votes to pass the Senate health care if certain changes are passed separately through reconciliation process. Let me get you to respond to that, Chris.
Well, that's big news. I mean, that is one now you're going to see that it become a very key part in this speech, and I think you're going to see the president make a very strong statement about now's the moment to get health care done and move forward.
Jennifer, I got a minute. You respond to this big Pelosi news that she's now saying she can, after saying before she could not get the votes to pass the Senate health care with reconciliation process here, though.
I think that this could mean more trouble, actually, for the Obama administration. What we saw happen in Massachusetts was a direct rebuke of the health care policies that this administration is trying to put in place. If you look at the amount of spending, which independents especially are very, very worried about, you know, President Obama is talking about a spending freeze right now, but we're just talking about it on elevated budget levels from '09, where spending was up 10%. He also has exempted things like this $1 trillion health care proposal, like non-discretionary spending and entitlement programs, which take up 60% of the budget. So if you have news like this coming on, people are going to hear him out of one side of his mouth talking about spending all these new programs, but then also saying he's going to stop spending. That's going to be hard to square.
Hard sell for the president, but it is coming up in less than 5 hours. Thank you both for joining me, and thank you for joining me in the hour. Dylan Radic.